The Behavioral Consulting of Tampa Bay, or known as Bcotb, is leading the way in our area in the early intervention of autism. Joining us today with more on what they are doing are clinical coordinator Didi De La Osa and Dr. Nicole Agresto. Good morning, ladies.
Good morning.
So let's first start with, because I love what your organization is doing, a lot of providing a lot of help for families. But explain the partnership here, certainly, and we're going to talk about some keys this morning that people need to look out for.
Of course. So Dr. Nicole Agresto is a community partner of ours, and she works in the diagnosis end, where we work in the treatment end of children with autism spectrum disorder.
It's an important relationship, I'd imagine, there. So let's dive into that, doctor. And what is it? Because it's changed over the years, I think, certainly signs and things to look for. What do you think is most important for parents to know this morning, certainly when it comes to autism? I know it's a lot.
There is a lot, and there's definitely variability above it. Every child presents a little bit differently.
Yeah.
So I think the important thing is when you look for certain signs and symptoms, look for the frequency of the behaviors and intensity.
Okay.
So some children present as difficulty with their communication skills, which could be both verbal and nonverbal. So they have limited vocabulary or aren't speaking during the typical age range, or they have difficulty even with their gestures, so pointing to objects, pointing to people, understanding like what a thumbs up means or a shrug of the shoulders. There's also repetitive behaviors where they may play with toys in a very specific manner, like things set up just so. And if anything, if any of that gets disrupted, then there's usually an extreme negative response. There can be a lot of negative emotions where tantrums a lot that are very severe, and they have a hard time calming themselves, or parents even helping console them. Sometimes their faces look like they're not happy. They have like a blank stare, or like expressionless look. Eye contact can be reduced. The children tend to like things in a very routine. Changes in routine is very disruptive to them. And then
I can imagine a lot of these are hard for parents to know, because some of these I think are somewhat they see a lot.
Well, just development in general just is different for each child, and there's a range, and that's where it's important to consult with your pediatrician if you have any concerns.
And talk about the importance of early intervention as well, because we're able to do that earlier as well. We only have about a minute left, but that's so important and so key now.
Yeah, well, what we know about development in children is that the impact of experiences on brain connections is that it's greatest during the first 3 years of life. After age 3, experiences are impactful, but not as significant. So the hope is with early intervention experiences, it will help improve brain connections, and then we'll see significant gains in cognitive ability, social, emotional, and age-appropriate behaviors, and language development.
So you really are seeing signs and benefits of making sure that we get in there early.
Absolutely.
And start working with the children.
Absolutely.
That's fantastic. So if a parent is watching this morning, they want help, they have questions. I know we always have questions as parents. What would you have them do? What's kind of that? I know you mentioned pediatrician.
Always contact your pediatrician, look for a formal diagnosis, and always look at Bcotb's Toddler Achievement Program. We focus on children about 1.5 years of age to 3 and 5 in the Toddler Achievement Program. We also have programs for children up to age 10, but we use natural environment training in the context of play to teach those key language skills, social skills, adaptive skills like attention span, things that you wouldn't get at a regular daycare center. And we mimic a classroom in a daycare, so the children learn parallel play and social skills, and it's a very positive and nurturing environment for the children.
Well, ladies, thank you for all that you do. Again, I know that this is something that a lot of families here in the Bay Area need. We're so thankful that you're here. Thank you.
Thank you.
Thank you.
All right, and then for more information on autism and ABA therapy, give Bcotb a call, the number there right there on your screen, or visit their website, bcotb.com/programs.